Good afternoon. This is the special coverage of the coronavirus crisis using the combined forces of News 5, Signal TV's 1 News, Radio 5, and 1PH. Italy's death toll from COVID-19 has surpassed that of China, where the virus first emerged. The number of deaths in the European country has now reached 3,405, becoming the deadliest center of the COVID-19 pandemic. Meanwhile, the current number of deaths in China stands at 3,242. The Thailand government is preparing to prolong the imposed emergency lockdown measures across the country. The medical city in Pasig is backing the health department's move to designate hospitals which will exclusively handle COVID-19 cases. In our newscast earlier, TMC President and CEO Eugenio Jose Ramos says that their resources and medical supplies such as personal protective equipment or PPEs and surgical masks are running out. Given the current trend, Ramos says the hospital's resources will only last for 2 more weeks. Ramos also says that they are now short on personnel, with almost 200 medical staffers who were exposed to COVID-19 patients now under quarantine. Some doctors, he says, are now in intensive care units.
About 3 days ago, we had 191. 191 na doctors and nurses na quarantine, no? And then they have to stay for 14 days.
Opo.
Kung wala silang symptoms, okay na, there's no need for testing. But we will have to wait. We have to wait. Ang protocol ng WHO, you have to wait for 14 days. So you can imagine na dagdag ng dagdag yan, exponential yan.
Now, to give their experience since the Luzon-wide quarantine and how their personnel are coping, we have on the line Asian Hospital and Medical Center's Director for Innovations, Dr. Randy Cañal. Good afternoon, Dr. Cañal. Thank you for joining us.
Good afternoon, Ed, and thank you for this opportunity.
Yes, Doctor. Doctor, first of all, yung Asian Hospital, ilan po yung inyong, kung meron man kayong pasyente na positive or person under investigation or PUMs, any which one of those, meron po ba at ilan?
Yes, okay. I can give you a brief rundown of some latest numbers that we have, no? Ang total number of PUIs na nakita na mula noong January ay 203.
Okay.
Ngayon, yung na-admit ngayon na PUIs in combination with a 60. Among those, actually, yung na cases ay 6. No? Tapos, tuloy-tuloy yun sa mga those indicated for testing. So again, to reiterate, we have currently 60 admitted PUIs or COVID positives. 6 na yung naging pasyente na positive sa Asian Hospital.
Sorry po, we kind of lost you there. 6 po yung positive sa Asian Hospital.
Na naging positive na yung result.
Na nag-positive. But are they currently there in Asian Hospital or have they been transferred to, for example, RITM?
Yes. Out of these 6, 3 are in ICU. The 1 is recovering in our facility. And 1 is already recovering as an outpatient.
The reason we are asking all these questions is we also want to know how it is for your health workers there. Kasi once a hospital handles or treats people who were exposed or people who are positive, siyempre po may mandatory quarantine period ng 2 weeks. And in our last discussion with, for example, Medical City, ang sabi po ng Medical City, they're kind of running short on personnel kasi ang dami naka-quarantine and that is mandatory po. How about Asian Hospital po?
Yes, that is actually, you're correct there, no? That is the big story for healthcare facilities. Lahat ng ospital, lahat ng mga doctor, nurses, and other personnel are always worried about that. And for us to avoid losing all our healthcare workers, we have to have personal protective equipment. Yun sa ngayon, yun yung basically magbibigay ng some kind of exemption from quarantine. Imagine mo kung makadako ka lang isang pasyente, nurse ka, ibig sabihin 14 days ka nawala.
Opo.
Hindi sustainable talaga yan kahit saan dako ng mundo. That in fact, of course, we follow rules for quarantine, but in fact, even the Center for Disease Control in Atlanta has already issued the advisory na healthcare workers na may nawalang symptoms, pwede magtrabaho. Although, that hasn't reached our shores yet. Pero sa tingin ko, parating na yan doon. Otherwise, walang matitirang doktor, nurses, at healthcare workers.
What about your case po? In the case of Asian Hospital, would you have any numbers as to how many, if at all, how many of your personnel are now undergoing quarantine? And of that, how many percent are they of the total number of personnel you have?
I don't, so far, I don't have the numbers in front of me, Ed, no? So ayoko manghula.
Opo.
Pero among our staff who are exposed that are considered DUIs, 6 results have come out negative so far. So that's, pasalamat kami. You know that we tried our best to maintain infection prevention controls, di ba? Yung very active yung Asian dyan from the very start. But of course, I also heard yung sinabi ni Dr. Ramos na hindi limitless yung supply ng mga personal protective equipment.
Opo.
At ngayon, doon kami talagang naghahagilap ng resources para makakuha niyan. Kahit may pera ka kasi kung walang mabilan, mahirap.
For example po, saan po kayo nahihirapan when it comes to PPEs?
Well, the basic PPE kasi should include the matinong mga mask, no?
Opo.
Kahit yun, no? Yung magagandang mask, medyo may laban ka naman pag harap ka talaga sa pasyente, yung mga sinasabi nilang N95. And even the other protective equipment such as face shields, gowns, gloves, booties, yung para sa paa. Kasi pag nag-handle ka talaga directly ng pasyente, required yun. Pero pag nasa malayo ka, labas lang, really, mask is acceptable basta wala ka dun sa area na high risk na sinasabi. So that's all those kinds of personal protective equipment are very welcome. Kung meron kayong source, kung meron kayong donation, I don't think any hospital will say na, ay, kaya namin to hanggang ilang buwan. Everybody is running out of these supplies.
As it is, how many more days or weeks are your supplies good for, PPE supplies?
I don't have that number, sorry Ed. I don't have that with me now. But we have enough to sustain, I believe, for the next week at least, baka 2 weeks, but I'm not sure.
Okay, well, at least a week or two at the very least. If you were to have any message to people out there, what would it be? Whether it's how to take care of themselves and not become victims of COVID-19, down to what they can do to help our health personnel.
Okay. The first part of your question, no, ang daming pwedeng messages, but let me just siguro pick out the most important ones, no? I think ang COVID-19 na ito, nandito na yan. Nandito na yan sa bansa natin. So, we already know from the lessons from other countries and other hospitals na most cases will be mild or will be flu-like, parang sangkas lang. Hindi kailangan ng hospital, kaya kailangan mag-distancing tayo. Pero yung small percentage, the 20% that you have more symptoms, plus yung liit dito na around 1 to 2% from there na magiging critical, pero kailangan dito yan. Kasi yun ang kailangan paghandaan natin. And I think that big hospitals, tertiary hospitals, have to build that. So for the public, yung symptoms, according to our guide from the view and from other healthcare experts, kung mild, huwag nyo pahirapan yung sarili mo. Stay at home. Pero pag gusto nagiging mas severe na yung kondisyon nyo,
I'm sorry, we're losing Dr. Randy Canyal. The signal is not very good. But anyway, maraming salamat po, Dr. Randy Canyal of Asian Hospital, for the information and also for your insights. The arrival of the Olympic flame in Japan from Greece was celebrated in a scaled-down ceremony on Friday due to the growing COVID-19 threat. Former Japanese Olympians collected the flame from an aircraft at Matsushima Air Base and took it to a cauldron on a stage in front of selected guests. Daily arrival and departure ceremonies are closed to the public. All torchbearers will also have their temperatures taken before participating in the actual relay scheduled to start on March 26. And that's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, The Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.